we are currently at a point politically where half the country says repeal and half the country is going reform the healthcare system. And that's part of the confusion. There is no leadership nationally, in my opinion, that is bringing a consensus into this problem so that we can all work together towards solutions that we're describing. And to me, from a leadership standpoint, that has to occur in order for us to have any promise.
But Mike, the strong leadership, polar leadership on both ends of that.
Yeah.
There's very little moderate leadership, if you want to call it that, in the middle.
And that's going to defeat what we're describing here about the promise of this reform activity, which we all, I think, support.
Well, that's why we cannot depend on politicians in Washington to solve this problem. It's our problem. It's the problem with the people we're supposed to take care of, and we better drive this agenda and take charge of it.
Where does it come together? It comes together in communities with doctors, hospitals, other elements of the health system, much less the broad set of community organizations, coming together and say, we need to do something about that.
Well, and the good news, we've progressed to a state in this country where everyone understands we've got a huge issue with the health of our population, and it's time to do something different. So, maybe if nothing else, it's a good wake-up call for all of us. And I think I agree with you. This is not something we can leave up to people in Washington or politicians or any one sector. In fact, it's not something we can even leave up to just the healthcare leadership, the healthcare industry. We've got to persuade every other sector that they've got a stake in this, and we're all equally responsible.
Well, and one good piece of news, I think, hospitals and physicians have had very diverse financial incentives, very diverse clinical incentives for a long time. Can you imagine the power of those coming together? That would be significant. That would be very helpful, I think, in going forward. And most of the systems that I talk to have made it very clear to physicians that a lot of them are coming in for the wrong reasons. They're coming in for malpractice protection, or they're coming in for reduced administrative overhead, or they're coming in for whatever reason. What the systems are telling them, we want you to come in so we can help you practice better medicine.